Hello everyone, I'm Dr. Roche. Welcome back to my channel, and I'm here to assist you in helping you knock out your NCLEX. All right, so today we're going to talk about priorities and how we can read this into the questions and how to start to determine now using the priority as far as how it's going to help direct us moving into our answer selection choice. If you haven't seen my previous video yet on, I believe it was a half an hour long, of kind of going through and how to break down the questions and use the nursing process, I would suggest you go ahead and view that as soon as you can. The other thing is you want to watch this video to the end because I'm going to have a special offer and you just may be very, very interested in. And it's going to be only for a select few. And we'll talk about that later. All right. So we have our priorities. Everybody has heard in nursing school, ABCs, right? Well, I'm going to add some emergency medicine into this. It's going to be D and E. And I'm just going to cover each one of these and make short videos to break everything up to make it easier for you guys. All right. So obviously the first priority we're going to have is going to be our A, which is going to be our airway, right? All right, let's take a look at our first question here. A nurse is assessing a patient who just arrived in the ED. So when we first start looking at this first part here, the very first sentence, we have a nurse who's assessing a patient, and now we have our environment of the ED. As for this goes, we are now currently in the process, right? Which part of the process are we in? We're in our A. How convenient, it shows us right here, assessment. All right, now let's move on to the next sentence. The patient is gasping for breath with audible wheezing and labored breathing. Now, we look at our process through here. We have a patient that's gasping for breath. They have audible wheezing and labored breathing. If we're in the process and look at the process here, we're still in the assessment. We're getting assessment. However, we now need to start focusing our attention and shifting. Anytime we have something with a patient who is gasping for breath and they have audible wheezing, labored breathing, we should start to think that we're moving into priorities of ABCs, right? So, definitely wheezing and labored breathing. If they have wheezing taking place, we have some constriction going on, which means we have an airway problem, right? Which action should the nurse prioritize? Let's look at our answers. A, checking for the patient's blood pressure. First thing you want to ask yourself is, are we in ABCs through here? Where is our answer selection at? Checking for blood pressure, that's looking at a circulatory issue, right? Administer oxygen therapy. That could be breathing. Could also be helping with the airway, right? Notify the patient's family. Well, this actually goes to Maslow, and it's a Maslow priority, which we'll get into that later on. Drawing blood for lab testing. This is an intervention more than anything else. Why we want to draw labs for blood testing? Maybe we want to look at an ABG and see what's going on there, right? First thing you have to ask yourself is, which one of these, if I do not address and do immediately, could cause the most amount of harm to our patient, up to and including death, right? Obviously, our answer selection is going to be, we want to get some oxygen on them. We don't have anything else here. We don't have anything in here as far as intubation or anything like that nature. Plus, we don't have enough information up here if we're going to be doing intubation. The only thing that has to do with airway breathing on here is B. So that has to be our answer. Again, this is just going to be a brief video. Now, let's talk about the special offer. I am only right now currently have room to accept 10 people who are extremely serious about passing their NCLEX exam and you want to pass it now. I'm going to be offering a 4-week course that is going to get you prepped and prepared that in 4 weeks' time, you're going to be able to take your exam, your NCLEX exam, and know you're going to ace it. If you're interested in that, please look in the description and click on the link that's in there, and it'll say special offer. All right, so I want to help you knock out that NCLEX. All right, hope you guys enjoyed this. I will talk to you soon.